Norbert Gleicher, MD, Medical Director and Chief Scientist here at the Center for Human Reproduction. And I'm having a chat with my colleague, David Barad, who is our head of clinical IVF and of our research program. And it is mental health months in pregnancy. And that means that we need to say something about it. And it is probably nowhere more important to talk about mental health than in the kind of patient population that we serve. What would you say? Why is it that
I think we deal with a very informed, very intelligent, very competent group of patients who knew enough to come to see us. But you have to remember, this is one of the more stressful things that you go through. We go through life, we expect our bodies to do the natural things we expect our bodies to do, and getting pregnant and having babies is one of them. And when it doesn't happen, you feel cheated, you really feel cheated. And then you go through, we kind of go through life expecting, well, maybe, technology, medicine is so advanced, maybe it can be the instant fix. And the bottom line is, it's not always. Sometimes it is, but sometimes it's not. And it's very frustrating to spend the time, the effort, and the money on these procedures and sometimes not be successful. So on top of that, you're taking hormones. And you have to remember, your hormones go up to 10 times what they would be in a normal cycle. And I tell my patients, you might be going down the street and you see a kitty cat or something, you'll start crying because the cat's cute. It's just you're not going to be yourself, and you have to remind yourself and those around you that you're functioning in a different way.
You take hormones, and if you are pregnant, of course, the pregnancy produces hormones.
Sure.
So it's hormone hell. Before pregnancy, while you're trying to get pregnant, and then into pregnancy to some degree. And you made another very important point that is worthwhile re-emphasizing. That's the psychology of becoming a mom for a woman. It is historically, or it has been historically always, the quintessential evidence for her womanhood to be a mom. And so not being able to conceive obviously puts enormous social, psychological pressure.
But even more than that, our patients are people who are highly educated, oftentimes have gone to the top of their fields, have been very successful in everything that they've done.
And have tried very long before even coming to us.
Here.
So they are really the ones who are more than the average infertile patient suffering from whatever these psychological stresses are. It's a very, very unique patient population that requires a lot of attention, especially if you have gone over and over and failed. It must be horrible. And those patients need special attention, and I hope that we provide that here at the CHR.
Well, we try to provide it, but it's also important to remember that there are groups, support groups that you can talk to. Now there's all kinds of chat rooms that you can go to, and it just, they may not always have the most accurate information, but they certainly can provide support to each other. And there are professionals out there that can counsel people and help them.
That is a very important point. That not only are there professionals out there, but there are now already professionals out there who specialize in counseling patients who are either trying to get pregnant or are pregnant and, for example, suffer from repeated miscarriages, which is also a form of infertility in a way, and sometimes even harder to tolerate than not getting pregnant.
My daughter reminds me that and actually has talked about this on her blog, that even when you become pregnant as one of these successful people, your life changes when that child comes, and that can be a great challenge.
It's not easy to be a woman.
Not easy to be a parent and to have all that added responsibility.
Absolutely.
Your life changes completely. And so just remember, the hardest thing is to try to do these things alone.
Yes.
The most successful people are those that reach out to their various supports and create a support system.
And who are just talking about it, who don't
Hold it in.
internalize it and keep it to themselves. You really,
If you're feeling something, it doesn't mean there's something wrong with you. It means you're a normal person going through these normal reactions to these stresses. In infertility treatment, even when you're successful with it, even when you have your baby, just reach out and use the support systems that are there.
absolutely. And as I said, if anybody feels that they need professional help, you can always ask us here at the Center for Human Reproduction. We will be happy to refer you to a competent
We have
person.
several professional colleagues who do this every day.
Day in, day out, and do it well. Okay? Thank you.